My name is Cameron Arani, and I'm an operating room nurse at the Hospital for Sick Children. So a custom pack, or also known as bundle, are all the single-use supplies and items that a surgeon and nurse need for the course of a surgery. It includes the sterile drape that covers the sterile field, as well as the often single-use gowns, bowls, vessel loops, even all the items that you need for the course of a procedure that will be thrown out at the end of a case. So the problem with custom packs is they more often than not have too many items in there that you don't need for the surgery. So these items can be single-use gowns, they can be vessel loops, they can be bowls that during the course of surgery you just don't even touch, and they end up getting thrown out into the biohazardous waste stream or the regular waste stream, which then increases the CO2 emissions for your institution. Root cause wise, one of the main fears and one of the main reasons why individuals put too many things into their custom packs is out of fear that they need something for procedure, and if they don't have it, it can be detrimental to patient outcomes. So specifically with custom packs, many institutions are financially driven to revise them every once in a while. They don't want to be ordering more supplies that are necessary. So at our institution, it's a yearly or so practice that we do. We'll gather our nurses together and figure out what needs to be cut from this custom pack in a way of reducing costs. And coincidentally, we also realize that with reducing costs and cutting down from the custom pack, we're also improving our environmental footprint and reducing how much gets thrown out, because we're also then reducing the cost associated with waste handling. So our current process and our future process are going to be different. In our current process, our registered nurses within specific services will gather with their CSNs, or clinical support nurses, and they will together figure out what items are not included or not necessary from a custom pack. In our future state, though, we've realized that our surgeons need to be involved in this process, because more often than not, they are using a lot of the items that are within these custom packs. So we're trying to engage them now to better understand within our individual specialties what items they feel we don't even need to be including anymore. There's multiple vendors that exist for custom packs. It's up to the individual institution to figure out which vendor works best with their institution. Many of them actually come with sheets on the front that have a list of all the items that are within it, and you can tick during a procedure which items are used and which items are not used, and then over time you can accumulate this data and have evidence to support why you want to remove specific things from the custom pack. What also works well is identifying in your pick lists specific items that can be single-use wrapped that you don't use as often, but you can open just in case you need it.